country, an epidemic of severe lung disease is affecting people who vape. So join me now to answer some of your questions about vaping is Dr. Constantine George of Southern Hills Hospital. Thank you so much for joining us this morning.
Good morning. Thanks for having us on.
Yeah, so a lot of questions now about vaping and how safe it is. So let's go to the numbers first. How many people have been affected by the disease?
So per the FDA and the CDC, as of October the 29th, there's been 1,888 related injuries from vaping in all 50 states aside from Alaska. And as of October the 29th, there's been 37 reported deaths amongst 24 states. Nevada is not included on that list as of yet.
So vaping has been around for a while now, but it feels like this was a sudden rush of people who had this disease all of a sudden. So what is causing all of this?
We don't know. So the FDA put a report out. The symptoms of the disease, first of all, shortness of breath, chest pain, coughing, fevers, abdominal pain, nausea, vomiting are the symptoms that we tell patients to look out for. And then from an FDA perspective, they found a link with the vaping substances that have THC in them. We don't know if it's directly just the THC itself, but there is an association when they do research and they look at the product. A lot of the products have THC in them, and the people that are sick are people that admit to using THC substances for therapeutic and non-therapeutic purposes as well.
And I guess e-cigarettes rather, has been touted as a safer alternative to smoking for the longest time now. But what should people know before they vape or if they are vaping right now?
So like with anything, it's a nicotine-based substance, whether it's through an electronic delivery system or through a cigarette, you're inhaling nicotine, so it's an irritant to the lungs, and obviously we worry about it long-term, increased risk of lung cancer, obviously, so it doesn't matter what form you're inhaling it in, it's still a bad idea to vape.
All right. Is there anything else that people should know about vaping as it is right now?
If you're doing it, what I tell patients is make sure you go to a legitimate store. The FDA does scope out these places and look at them. Do not get it from a social source. Don't get it from an illicit source. You don't know what it's been contaminated with, so you have no idea what you're buying. So always go to the true source to buy it, just to guarantee yourself that you're getting a clean product and reduce your incidence of exposure, obviously.
Always important as well to keep tabs of what's happening and see what the FDA is telling people nowadays.
Correct. The FDA, go to their website and the cdc.gov as well. They're constantly updating their websites weekly, monthly, so it's a good resource to have. And then obviously speak with your primary care physician as well.
All right. Thank you so much for joining us this morning. Those are very, very helpful.
Thank you very much for having me.